From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
All right, ladies and gentlemen, thank you for joining us here from the Wood TV Live Desk. Want to introduce myself. My name is Luke Laster. I'm joined today with Grand Valley State University, Greg Sanial, and Maria Cimitile. Joining us here, Maria, the Provost for Grand Valley State, and Greg is the head of the Virus Action Team, also the VP for Finance and Administration. Thank you both for joining us today. Real quick, I can hear a little bit of echo in the background on one of your streams, I believe. Do either of you have it open at this moment?
I do not.
No? Okay, we'll have to figure that one out there real quick. But anyway, I want to talk about the Virus Action Team as a whole. How did that come about?
Yeah. Sure thing. Well, the Virus Action Team, when the virus was first identified, we set up an incident management team, which is a team that we have established. And that's usually deals with things like if we were to say have a fire or something like that, we stand up this team using the incident management system, which is used across the nation. That team handled our university response to the virus for several months. The problem being that the IMT structure really doesn't lend itself to an extended response. So what we did in late July is we stood up the Virus Action Team, and we were just entirely focused on isolation, testing, tracking, tracing, and quarantine, and coordinating the overall university response. There's 14 members of the Virus Action Team. I'm the director, and we have representatives. We have an infectious disease doctor that consults with us. We have some senior people in our Vice Provost for Health field. We have representatives from student affairs. We have 3 faculty members with specialties that are related. So it's a great team. I like to think of it, it's a great team of experts. And what we do is we meet every day and we're monitoring our dashboard, looking for how we can shift and respond to the changing nature of the virus. We keep track of isolation, quarantine, our testing program, and we continually shift and adapt to do everything we can to keep the university as safe as we can and being consistent to our mission to provide education for our people and doing it in the safest manner possible.
So big weekend here, students get back on campus. Explain a little bit about how many students, what we're looking at for the plan moving back this weekend.
Sure, I'd say roughly, we have about 24,000 students, but we expect only about a campus population of between 10 and 13,000 between students, faculty, and staff. That will be on our campus, more than once a week. We have about 6,000 beds normally, but we're expecting about around 5,000 because we have socially distanced our housing in consultation with the local health department. So we only expect about 5,000 students to move back in that will be living in on-campus housing. And then we have roughly the same number, maybe slightly larger number of students that live off campus but nearby in the complexes there on 48th Street. Maria, is there anything you'd like to add?
Just as we go through the move-in, we distance mandates that we know keep our community safe and healthy. We have a very well-oiled team that helps the students and their families move in. And we have lots of protocols that we've asked the students to take part in even before they've arrived on campus. Sure, absolutely. So what we want to do, of course, is to provide a high quality education for our students as well as a safe and healthy environment. And these two things are not mutually exclusive. So we have about half of our classes are purely online. Many of them are kind of a hybrid mode, which means that sometimes the class meets in person, other times it meets online, and then a smaller percentage of courses that are pure face-to-face with all of those social distance parameters in place as well. That allows us to really merge our excellent academic pedagogy with health and safety. It provides our students with the kind of learning opportunities that they know they need, as well as thinking about those things that are very particular. For instance, our health clinicals, where we know students need to be in person, face to face, in order to learn the competencies that they'll need to graduate.
Sure. We do a lot of different kinds of testing for COVID on our campus. If you're symptomatic, we have a symptomatic testing program, testing clinic set up. If you're asymptomatic with exposure, known exposure, we have a testing program for that. And then we also have a surveillance testing where every week we test a random number of students and some directed testing that we do, where we'll be testing, for instance, people that RAs will test weekly, people that work in food service will test them more frequently. Faculty that are in face-to-face classes will test them weekly. For repopulation, what we want is all of our students and faculty and staff that are returning to campus, we want all of them to be tested in about a 2 to 3 week window, so that we can identify right away any of those people that are asymptomatic but positive. So we want it so that we can get them isolated and quarantined as appropriate. So what we've asked for instance, our students coming back is they have 3 options. They can either test at home before they come back to Grand Valley and just let us know the results of that test. They can test when they get to Grand Valley. We have expanded our testing program for them. And then, that day or so that they need to wait for their results, we ask them to stay safe. And then those that don't want to test for whatever reason have the option to do so. They can come to Grand Valley, but they need to stay safe and basically stay in their rooms except to go to class and eat and get food or medicine for 10 days so that, and if they don't want to test. No, actually, our athletes, in-season athletes, are being tested 6 days a week right now, and that's in line with the MDHH orders that went out in December and have been renewed a couple of times. An athlete that tests positive is treated no differently than anyone else that tests positive. As far as they go into isolation for 10 days, we do contact tracing with all of them, and close contacts then also have to get quarantined. So we don't treat them any differently other than we test them much more frequently. In fact, we've got a great program with our athletes. If they show, to give you an example, we're actually much more aggressive with our athletes, getting them into isolation or quarantine even ahead of when they get their test results. An athlete that has the sniffles, we're going to assume they're positive. We're going to get them tested and immediately put them in isolation and track all their contacts and get them in quarantine and get them tested. And so we've had that happen where, they'll get tested and then a day later or 2 days later, the test is negative and then we can release them. But we act immediately with our athletes to get them into isolation or quarantine as appropriate to limit the spread.
And so moving on now to vaccinations, Grand Valley, have they been in contact with the county in terms of providing vaccines for professors and faculty? How is that working out on the university's campus?
Sure, we meet regularly with both the Ottawa County and Kent County Health Departments. We meet with them twice a week, and we're coordinating very closely with them on vaccines. We are providing our Holland campus is a vaccination clinic that is being run by the Ottawa County Health Department. The health department has not provided any vaccines at all to Grand Valley. All the vaccines are being distributed through health systems and through health departments. So it's the health departments and hospital systems that are actually doing injections. For Grand Valley, we're providing space to do that on our Holland campus. But we work very closely with them. We let them know how many people are in our community that need to be vaccinated. And the county is following the guidelines from the state with the different priority groups. And so, for a Grand Valley employee or faculty member that is in one of those groups would get notified and would sign up for a vaccine with the health department or through their health systems. We are tracking members of our community that have been vaccinated. It's up over 300 now. Primarily, it's our first responders, our police department. We have a number of students that have been vaccinated that are in clinical settings and things like that. So they've been vaccinated as part of their work that they're doing. And then obviously we have employees and faculty that are over 65 or might have other health risks that have been vaccinated. But all those reports of vaccination that we track and have on our dashboard, those are all self-reported through our daily self-assessment system. But Grand Valley does not have any vaccines, and Grand Valley has not administered any vaccines yet.
I want to elaborate a little bit on the online features that you have with the vaccinations. Can you explain just the format of that?
On our dashboard, the vaccination counts that we have. Sure. We ask all of our faculty, students, and staff to do an online daily health assessment. And one of the questions we ask them is, have you received the vaccine? If so, have you got one shot or two shots? And so it's all self-reported information that we're then posting on our dashboard that shows all of the data that we have in a very transparent way related to COVID, has cases and positivity rates and testing rates and things like that. But that's just something else that we're tracking. But again, that's all self-reported. These members of our Grand Valley community that have been vaccinated have done that through the health department or through a hospital system, and it's because of the nature of their work or their age.
So moving on now to specifics of protocols that will be in place per building on campus. First, let's start with dorms, keeping those clean. Obviously that could be a tough maze to go through with all the dorms. What protocols will be in place for those RAs or, the front desk workers, keeping that building, as spotless as they can?
Sure. Well, with all of our buildings on campus, we've worked with the health department since last summer, actually since last spring, to create the social distancing in our living centers. We converted the classic bunk bed college dorm kind of thing. Those have all become singles. There's limits on how many people can use a community restroom, for instance. So again, normally we have about 6,000, 6,100 student beds on campus. We're only occupying about 5,000, 4,900 right now to create that spacing that we need for the social distancing. Additionally, people who in a forward-facing or public-facing role, there's plenty of plexiglass dividers. We have a lot of our furniture has been removed in common gathering areas to again create that spacing. So we've done all that, specific in our living centers. Again, the RAs, they're equipped with that. We've also deployed a cleaning product that is long-lasting, antimicrobial, antiviral, that has been applied on all of our common surfaces. What we call enhanced cleaning protocols are being used throughout all of our buildings. So we've been doing everything we can since the start of the pandemic related to that, to keeping our buildings safe. And through our contact tracing, we have not seen spread in those areas at all. We have not seen spread in our classrooms. We have not seen spread that we can trace to, our building's activity or cleanliness in there.
Any other guidelines that you'd like to kind of hit on with the return of the students this weekend?
Maria?
Well, I think, we're really stressing with all of our community, students, faculty, and staff, that wearing your mask is incredibly important still. Even with vaccinations, we will still ask people to wear masks and wear them properly, which means cover both your nose and your mouth, both indoors and even outdoors. We know that the spread of this virus can continue, and we're waiting for guidance from scientists regarding after one has received the vaccine, can a person continue to spread the virus even though he or she may not become ill oneself? So making sure that all of our community and our students in particular understand what it means to have a safe environment for our educational opportunities. So that's one of the things we continue to do. We have student kind of mentors with that, and helping students understand from one another how to stay safe as they continue on in their studies.
Any other from either of you, and this has been great and informative on both ends here, but Greg and Maria, any other plans that you have that you want to share, I guess, moving forward here as students get back?
Well, I think, one of the other parts of the pandemic is making sure that people are in a good mental space. And so we have many resources on campus to help people understand self-care, resources if they're struggling a little bit with anxiety or depression. We have lots of resources on campus for that as well. And most importantly, to maintain who we are as a community, that we look out for one another. And that we reach out to one another, that students stay engaged, that faculty and staff stay engaged with one another if we can make it through these last few months until we have a very good, safe health environment across society. We want to make sure that people know that we're Lakers first.
So from either of you can answer this question, I'd like to end these on a good note. The question I always go out asking is, tell me something good. Maria, that was actually pretty good leading up to that, but if either of you, tell us something good.
Well, I think I would just add that, we learned a lot of lessons when we repopulated the campus in late August, and we're applying all those lessons now. And we're very fortunate in our wide campus community, our students, our faculty and staff. I think that they're all very supportive, all very interested in making sure that we can continue to execute our mission of delivering education, even in a health-informed way. And everything works together. We have a testing program, we have masks. We want everybody to wear masks. Testing program, we have physical distance in our classrooms, physical distance in all of our common spaces. And it all works together. We can't just have you can't just have a testing program and be successful. You have to have it all. They're all mutually supportive. And I think I really am really proud. Our Grand Valley community, our wide community, they all get it. And they all are supportive, and they all want to do the right thing. And like Maria said, we're in this together, working together, and we're doing the best we can. And we're going to punch out on the other side and be a stronger community for it when it's all over.
Oh, there we go. Maria, anything to add?
I don't think I can top my colleague on that. He's really been at the forefront of, looking at what those right protocols are by having that great team, the virus action team. And so as I said, we're really lucky to have a community that can come together for all of our sakes.
All righty. Well, thank you both. I really do appreciate both of you taking the time this afternoon to take a moment here for this live desk conversation. I'm going to wrap it up now. Ladies and gentlemen, thank you for watching here in our live stream. You can find this over on woodtv.com or on our Facebook or Twitter pages. Greg and Maria, thank you again, and have a great afternoon.
Thank you.
Thanks, Luke.